Welcome again to another edition at Tiny Feet, Big Steps. I'm Mbozu, your Global Neonatal Podcast host, and we have another incredible person with us, Dr. Jonathan, and he'll tell us a bit about himself, his story, and how he's connected to the Tiny Feet, Big Steps conference. So hello there.
Hello, Mbozo. How are you?
Good, how are you?
Very well, thank you.
So could you please share a bit about yourself and your background and whether it's your first time here at the conference?
Thank you. Well, very excitingly, it is my first time at the conference. I'm the first obstetrician to be invited to speak at the Tiny Feet Big Step conference. So that is a huge honor in itself. But also I think it's really important because what we really need to learn is how obstetricians and midwives can work more closely with neonatologists and neonatal nurses. So this is my first time, and it was a great privilege to talk about the things that we need to know that we can do together to help save babies' lives.
And that was one of my favorite sessions because I think that is the big why with newborn outcomes. Like you had an amazing session where you talked about what newborn health workers need to know, linking in with obstetricians. So could you tell us more about what people need to know?
Thank you. I think what people need to know and appreciate is what benefits there are when obstetricians and midwives work closely with neonatologists and newborn nurses. What we recognize is that close teamwork, good communication and collaboration saves babies' lives. And although as an obstetrician, I have great respect for the new interventions with respect to ventilation and feeding and temperature control, what is really important is to recognize that there are simple interventions available to almost all babies born in Africa that can save lives. And I think two of those particularly are appropriate administration of antenatal corticosteroids to those women who require them for their babies. And secondly, the remarkable benefits of delayed cord clamping for the newborn. Both of these interventions have been shown to reduce in-hospital mortality. They're simple, they're safe, and they're effective. So what I was really urging those people at the conference is to go away and to think not only how they can implement these practices in their hospital, but how do they measure to make sure that mothers and babies are receiving these simple interventions that save lives.
That's what we need, really, that better communication between the antenatal obs plus the newborn side. Do you have any examples of where you basically brought in that culture shift between obstetricians and newborn health workers?
An example of that collaboration where people's behavior changed actually came from my own country. I was the obstetric lead on what was called the Australian Placental Transfusion Study, which is the largest ever randomized controlled trial of delayed cord clamping in preterm babies less than 30 weeks. The study that was published in 2017 in the New England Journal of Medicine, doing the study was a really helpful learning experience for me. When we started, obstetricians, they wouldn't conceive of waiting to cut the cord. As soon as these small babies, some at 26, 27 weeks were born, the obstetricians wanted to cut that cord and give the baby to the neonatologist. It was very difficult to change that behavior, but by producing videos demonstrating how even these very small babies, while still attached to the placenta, begin to look around, open their eyes, and many breathe spontaneously. What we saw was over the course of the study, people's behavior changing and attitudes, and recognizing that as long as the baby is still attached to the placenta, the baby doesn't need its lungs. It is getting oxygenated. And when we think about that very simple delay now of up to 3 minutes, reduces mortality, not only in hospital, but if you follow that to 2 years of age, that's remarkable because it's something we can offer all our tiny babies and make big steps together.
Yes, big steps for the tiny baby.
That's right.
Yes, that's very remarkable. And it's a good example of really how to mesh the two together. Because really, you don't have a mother if you don't have a baby. So you really do need to think of a way to bring them together and communicate better and change the culture of how we treat our newborn babies and our mothers too.
That's right.
So how did you get to know about the conference? And what are your thoughts about the conference so far as a first-time attendee and speaker?
This is a remarkable conference. Tiny Feet, Big Steps. I learnt about it because I have the great privilege of coming to Tanzania, to Maternity Africa, a hospital in Kivalini Estate, which cares for the most marginalized and poorest women in Tanzania. Since 2019, I've been coming and volunteering for up to 9 months. And in that time, our hospital has developed from having really no newborn service to having now quite a sophisticated neonatal intensive care with bubble CPAP. And what we have seen is that, again, very simple interventions have made a difference to how our babies survive. My exposure to the conference was through our association with Dr. Swanson, who very generously has helped us develop our facility. And he told me about this conference. I'm aware of how much work it is for him to put on, but I can see why he persists in that work, because it is remarkable to see so many fellow colleagues from across Africa with a passion for providing the best possible evidence-based care for their babies. It's remarkable. And I just think the practical sessions where people learn the practicalities of resuscitation, ventilation, feeding, ultrasound to assess the baby, it's remarkable. So if you're hearing this and have never been, put it in your diary for next year.
Yes, and I'm sure you'll come with more obstetricians next year as well.
I did complain to Steve that we must remember life doesn't begin at birth. The obstetricians and midwives play an important part. So I'll be flying the flag again, God willing, for obstetricians next year.
I love that. And it would be a great story, really, from starting from 4 years ago and then now more obstetricians and more neonatal people just knowing about this amazing conference happening. All right. So another question I have for you. What are your hopes and expectations for this conference? As an obstetrician who's coming for the first time, where do you think would be the best way to take the ethos of this conference going forward?
Thank you. I think my hope for this conference is it really begins to help develop this idea of perinatal collaboration and the perinatal team. So we have obstetricians, neonatologists, midwives, and neonatal nurses, but really begin to get this idea that these people are one team and it's a perinatal team. So we don't have an obstetric team or a neonatal team, but it's perinatal. And what this would result in is that there is far greater dialogue between obstetricians and neonatologists, thinking about optimal timing of birth, optimal treatment at birth, such that with that sort of attitude and attitudinal change, our babies receive even better care. And I think we are now at a time with conferences like this, bringing obstetricians and midwives here where we can deliver that. So I'm very excited for the future, and I'm just amazed at the commitment and the passion and the dedication of those such as yourself, your toolkit, which makes this happen. And what I really hope to convince you is some of these antenatal interventions can be added to your toolkit.
Actually, that's definitely something to explore. How do you think others can get involved with the Tiny Feet, Big Steps conference?
So I'd encourage anyone who's interested to get involved, reach out to people like yourself, Mbozu, or Dr. Swanson, because really we're very anxious that anyone who has a passion for ensuring the best possible outcomes for babies in Africa is able to access tremendous resources that are made available through meetings such as this. And, we're doing this because we're caring for the smallest patients in our hospitals, and let's do it together.
So much wisdom, so much wisdom, and so thankful. As you can tell, it's a busy day here in Arusha with so many people moving around because it's so, so beautiful. But thank you for making the time to talk. And yeah, hoping that more obstetricians like you join and speak on the perinatal link.
Yes, thank you so much. And I really enjoyed your talk. Congratulations on what you're doing. And
thank you.
Yes, let's go forward together.
Yes, and faster together.